So, we are presenting on family coordination, and family coordination is used with resources like time management to optimize family and individual health and goals. And the purpose of this presentation is to explore family coordination among parents and children living with autism spectrum disorder.
Using MapScholar, we typed in family coordination and found an interesting article related to autism and family coordination. From our initial article, we used the hyperlinks from their reference list to find our other articles related to family coordination, autism, and the feelings around them.
It is found that the severity of a child's diagnosis of autism spectrum disorder may negatively alter the functionality of the family. This may be caused by an increase in stress levels that are associated with the child's developmental delays. Often this results in problems within parent-child relationships and internal caregiver relationships. When behavioral problems become more prevalent, parents' fatigue may also increase. Fatigue can also be caused by poor sleep quality due to the stress, a high need for social support, and poor quality of physical activity. However, participating in social support groups for parents who are raising an autistic child has been shown to improve well-being and increase positive maternal relations.
Family coordination is used with resources like time management to optimize family and individual health and goals. The theme of our case study is family coordination. We chose to emphasize family coordination by examining multiple studies associated with stressful family experiences raising children with ASD. This theme is explored through the lens of family caregivers, mothers, and fathers. From our literature reviews, it has been found that raising a child with autism negatively affects the caregivers psychologically and physiologically. Davies and Carter state that links between high parenting stress and concurrent problems in child and parent functioning have been demonstrated among typically developing children, and there is recent evidence of the negative effects of cumulative stress on children's behavior. These findings have a negative impact on family coordination. Communication is a major part of family coordination. When raising a child with autism, the communication aspect is disrupted due to factors related to developmental delays.
The severity of a child's diagnosis directly impacts family coordination levels. In children with severe cases of autism spectrum disorder, there is an increased risk that family coordination could diminish. With increased stress levels from the caregivers, the children's symptoms become more prominent. These results are dependent on the caregiver's own experiences with stress. Case study. A family has two children, one diagnosed with ASD, one without. They are seeking recommendations to decrease stress levels for all involved members of the family. They are open to trying multiple nursing interventions in order to strengthen their communication and coping mechanisms. They are taking steps to improve this by attending family therapy and being a part of education programs on ASD.
Some recommendations for nursing practice is educating parents on autism spectrum disorder, advising the parents to attend support groups to talk through the topics or answer any questions that they may have, and recommend that their children is involved with other children diagnosed with autism spectrum disorder, and also to develop coping mechanisms for the caregivers.
Some questions for consideration are: do siblings suffer increased stress as a result of having an autistic brother or sister? What are some ways parents can reduce the stress related to having a child with autism spectrum disorder? How are levels of family coordination affected based off of the age the child was diagnosed with ASD? And what about with the severity of the diagnoses? What resources can caregivers utilize when raising an autistic child? And what obstacles do caregivers face other than caring for a child with ASD?